Amid the increase in COVID-19 cases and positivity rate, private hospitals have also monitored a rise in hospital admissions. Let's get more information from Dr. Jose de Grano. He is the president of the Private Hospitals Association of the Philippines, or PHAPI. Good morning, Dr. de Grano. Thank you so much for joining us.
Good morning, Ria, and to all our listeners.
Now, sir, according to the Health Department's COVID tracker, there were 2,014 new cases reported yesterday. That means that the number of active cases has risen now to 16,504, and that number is said to be the highest new number of cases in 4 days. What we want to find out from you, sir, is what is the situation right now in private hospitals? How big is this increase in admissions over the past few days, and is it a cause for alarm?
Well, we have noticed for the past few days a gradual, steady, although not abrupt increase. And hopefully it does not translate into full occupancy. Some hospitals have gone beyond the 20%, and some even reached the 50% occupancy of their COVID beds.
All right, so 20 to 50% occupancy of COVID beds. So at this point, no one is being turned away. Patients can still be accommodated at this point.
Not yet. So we have not received reports of full occupancy of the COVID areas.
Doctor, can you tell us what are the nature of the cases? Are they symptomatic? Are they severe or critical? Because in previous interviews, you've said that some patients, they go to the hospital for different illnesses or treatments, but then when they get tested for COVID, it turns out they're positive.
Yeah, it's still the same. Most of the patients are admitted for other reasons or other causes. And then when tested for COVID, they turn out to be positive. So these are labeled more or less as coincidental COVIDs.
Now, Doctor, which areas or provinces or regions have recorded the most number of hospital admissions recently, or the highest number of admissions?
Well, it's still National Capital Region and Region 4. Of course, there's an increase noted in Western Visayas and, of course, the Davao region. Yes.
But as the way things are right now, we can still say that hospitals have enough supplies to cater to COVID-19 patients, yes?
Well, yes. There are still no reports of full occupancy. All our hospitals, especially the private hospitals, they are ready to admit patients. Although they really do not have any comorbid conditions, we usually try to advise them to just isolate themselves at home and look for other symptoms. And otherwise, we usually don't admit them.
All right, not if unless absolutely necessary. Doctor, thank you so much for your time. We appreciate it. That was PHAPI President Dr. Jose de Grano.